I always find going to the dentist quite traumatic. Most of the time it's fairly positive. There have been occasions where it's been really difficult, the procedure's gone longer, or there's been a problem that has come up while I've been in the chair. Even though my dentist is really good and talks to me about a lot of things and allows me to be in control as much as I can, still getting in that chair, lying down, being prone, having things in my mouth, being silenced, not being able to communicate with the dentist as well as I normally would be able to with another healthcare professional is really frightening. And I come out of it quite drained, I come out of it quite anxious, and I come out of it with my adrenaline pumping and my heart pounding, no matter how wonderful my dentist is.
Dental procedures and being in a dental chair could trigger a panic attack for some survivors of childhood sexual abuse, because you could be duplicating a situation. You're lying down, you're not in control of the situation, you're being asked to open your mouth wide and have various things put in your mouth, and there's somebody standing over you who's in a position of power. And dentists have a fair bit of power when they're dealing with us and our teeth, because they know far more than us, and we have to really take note of what they say. So you've already set up the situation for somebody who's very sensitive to what happened in their childhood, actually feeling that it's too difficult for them, and then actually starting with shallow breathing and ending up with a panic attack.
When I'm in the dentist chair, often I start to dissociate. At first, everything starts to glow and the room becomes quite surreal. Even the sounds in the room become very distant, and then I become just my mouth and my teeth. Everything else is sort of doesn't exist. My stress levels are usually really high at that point, and my adrenaline's pumping, but I can't move. I can't respond. I can't make signals to the dentist that I want them to stop or do anything, and you feel very powerless when you're in that situation. Even if I've only been in there for 5 minutes, it seems to me like I've been in there for an hour.
People don't deliberately decide, this is what I'm going to do, I'm going to dissociate, but what happens to them is that their mind decides, their body decides, this is really just too hard, and then they take themselves mentally away into another space. So it's not happening to them, it's happening to somebody else. People sometimes describe watching what's happening from being up on the other side of the room or being on the ceiling. It can happen to anybody, dissociation. We all do it at some time. Those times you've just gazed off into the distance, you've no idea what you've been doing for 5 minutes, or you drive somewhere and you have absolutely no idea how you got there. We don't need it if we've not got a history of trauma to be useful. It's just something that happens when you've got a bit of time out. But for people who have a history of quite severe trauma, in some ways it's a useful mechanism. What they need to do is then learn to control it, because you don't want to be dissociating at times when it doesn't suit you.